decision by Pennsylvania Senator John Fetterman to check himself into a hospital for clinical depression is drawing praise and well wishes today from congressional colleagues in both parties. Here to talk about this is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. Dr. Raja, thanks for joining us, as always.
Thanks, Eric. All right, Dr. Raja, let's talk about the senator's diagnosis first. We want to, of course, put out there, you're not treating the senator. We're just speaking generally here. But what is clinical depression and how is it different from other types of depression?
Well, Ben, depression can be classified as mild, moderate, or severe, and clinical depression or major depressive disorder is the most severe form. But there's lots of other kinds of depression as well, from seasonal affective disorder to postpartum depression. And depression is the leading cause of disability for people between the ages of 15 and 45 here in the U.S.
Okay, well, Fetterman's aides, they have said that the senator experienced weight loss, lack of appetite in recent weeks. We don't know about his other symptoms. Of course, we know he had suffered a stroke months ago. In general, though, how do doctors decide whether someone should, in fact, be hospitalized?
It's relatively uncommon, Erica. Most patients with depression can be treated as outpatients, but sometimes people who aren't able to function well on their own, like the senator, if they're not eating well, if they're losing weight, do need to get hospitalized. In the most severe situations, patients who are actually at risk of harming themselves or others really do need hospitalization, and those are often the patients who we see in the ER. But I'm really glad when they come to us because we have a lot of medications and treatments that can help.
Well, as Erica mentioned, Senator Fetterman suffered a near-fatal stroke last May while he was out on the campaign trail for that Senate seat. And today we learned it's actually fairly common for survivors of strokes to experience depression. I would imagine it has something to do with the fact that suddenly you have this, life-changing event and you just can't do things in many cases as easily as you once could. Is that the link or is there more to it?
You nailed it, Ben. That's the biggest part of it. And that's because depression after any major illness is pretty common. Like you said, your body's more stressed. It doesn't seem to work as well. You're tired all the time. All of that put together can lead to depression. That's why whenever you have a major illness, and if you start feeling depressed and sad, it's really important to reach out to your doctor if that happens.
Okay, Dr. Ali Raja, as always, again, thanks for joining us. Have a great weekend.
Thanks, Ben.
To our viewers, if you have questions that you'd like our experts to answer, just email them to ask@wcvb.com.
Friday.